So this is the chest needle decompression. First, we're going to assess the scene safety, make sure there are no hazards around, and we're going to apply the correct PPE for the situation, so mask, goggles, gloves. We're going to explain the procedure to the patient and gain their consent. So we're going to use a needle to release some pressure in your chest. We're going to ensure they're in a comfortable position and we've got enough light to see what we're doing. We're going to select the appropriate size cannula for the condition of the patient, have our sharps container within reach, and have identified the tension pneumothorax. So before we begin, we're going to administer high flow oxygen to the patient and give any ventilatory assistance required. So we're going to expose the side of the tension pneumothorax and identify the second intercostal space on the interior chest at the midclavicular line. We're going to say it's about here for purposes of this. So we're going to initially swab the site with the antiseptic wipe and leave that to dry after using the crosswise technique. And then we're not going to touch it to maintain sterility. So we'll remove the needle from its plastic cover, which, yes, we've done. So we're going to warn the patient, so we're about to do this, and insert at a 90-degree angle. The bevel direction is irrelevant at this stage, so we're just inserting it in the second intercostal space here and feeling for a pop as we insert the needle into the pleural space. And we're listening for that hiss of air that may be audible as thoracic pressure is decreased. And we're going to slide the cannula off the needle without advancing the needle further into the pleural space. We're removing that and disposing of it in the sharps container. At this point, we will attach a one-way valve on or over the decompressing needle. I don't have one of those. We're going to secure this in place with tape and then monitor closely for any further tension pneumothoraxes, and we can repeat this procedure if necessary.